Hi, my name is Shayna White, and today I'll be talking to you about the drugs in the thiazolidinedione class. Thiazolidinediones are anti-diabetic drugs that are used to control hyperglycemia in diabetic patients. The two main drugs within this class are pioglitazone and rosiglitazone. These drugs increase the utilization of the insulin that is already in the body. It reduces the hepatic glucose production so that the liver produces the appropriate amounts of glucagon. It is absorbed rapidly but may take a couple of weeks to reach full therapeutic dosing. It is 99% protein bound, it is metabolized in the liver, and it is excreted mostly in the urine and then the feces. Some precautions and contraindications to consider with this drug class include that pioglitazone can actually increase the risk of bladder cancer, so you should not be using it in patients that have a family history or personal history of it. You should also be very cautious in prescribing it to patients that have congestive heart failure, as it does cause new onset edema and can cause CHF exacerbations. It is a pregnancy category C, and it should never be used in patients with type 1 diabetes or DKA because there has to be some form of insulin production in the body in order for this medication to work appropriately. It is also used in extreme caution with patients that have hepatotoxicity because it is pretty harsh on the liver. In addition to the edema and the hepatotoxicity that we just discussed, this medication can also cause weight gain, headache, fatigue, and a big consideration is for females that are taking this medication that it can cause ovulation and interfere with oral birth control dosing. When selecting this drug, it is used in 2 to 3 drug combinations per the ADA guidelines. It is very rarely, if ever, used as monotherapy. You should always be using metformin and sulfonylureas first, but sometimes those medications are both contraindicated, and then you would use one of the thiazolidinediones as a monotherapy, but it is very rarely, if ever, used. Of the two medications in this drug class, pioglitazone tends to be prescribed more because it does have less side effects. Monitoring in these patients include the liver enzymes every 2 months for the first year because of the hepatotoxicity that can develop with it, and then normal hemoglobin A1C draws at every routine appointment. Aside from the normal diabetic education that you would do for any diabetic and making sure that they don't miss any doses and things like that, the main patient education that you should be focusing on with the female patients is the family planning aspect of it, because it can cause the ovulation and the decreased oral birth control effectiveness. So if they are not trying to get pregnant, it is important to stress to them to make sure that they are using alternative methods for birth control. In order to reinforce the points I made during this presentation, I made a storyboard about a nurse practitioner trying to find a patient to take a drug within this drug class.
Oh no, we're running low on oral anti-diabetic drugs. What do we have left? Just the thiazolidinediones, pioglitazone and rosiglitazone. The thiazolidinediones, but it's so hard to find patients that can even take these drugs. There are so many contraindications, and biguanides and sulfonylureas, like metformin and glipizide, are so much better and are always used first. I know, but it's all we have left, so we have to find the right patient to take them. Go out and try to find this perfect patient. Miss Jones, do you mind coming with me? Ma'am, we're trying to find the perfect candidate for this diabetic drug. I see you don't have heart failure, liver issues, or bladder cancer. What type of diabetic are you? Type 2. Perfect. Are you on or have you tried drugs like metformin or glipizide? I've tried both, but between allergic reactions and frequent episodes of low blood sugars while taking them, I can't take these types of medications anymore. Is there anything else that I can try? Yes. We have the perfect drug for your situation. Let me go get it for you. Which one? Oh yeah, pioglitazone is the preferred choice. Miss Jones, I'm prescribing you a thiazolidinedione called pioglitazone. It's the preferred medication in its class and is perfect for patients such as yourself. I just need you to know that this drug can cause ovulation, so if you're not trying to get pregnant right now, I suggest taking extra precautions with family planning methods. Thank you. I'll keep that in mind. You're welcome. We'll see you back here for your next appointment to check your liver enzymes and hemoglobin A1C and see how it's going. Whew, I did it. I found a patient for the thiazolidinedione. Really? Awesome.